in our exam area.
And last case scenario, I'll try a shin tape. Some people it's helped, some people it hasn't. And that's kind of what we do for shin splints, is just finding what makes that athlete feel better. Okay? So shin splints, we're actually going to be standing. Okay. I like to put something under their heel. You can use a roll of tape. You can kind of see downstairs we have, it looks like a black hexagon type thing that usually use like a tape roll put it together. It just acts as like a heel prop. So just gonna relax on there. I'm gonna go ahead and go straight onto your leg. Okay. So when we have typical shin splints or shin pain, it's going to go right along the front, usually right along where that tibia is. Okay. You guys able to see enough? I think you kind of come over a little bit too. So we're also looking, so for that middle area right in here is a lot of times where we have our tibial or shin pain. Sometimes it'll be along our anterior tibialis, but that's probably you're thinking more of a muscle strain type thing. Okay, so when we're starting with a shin tape, we're starting with our anchors. I'm gonna have you, as long as you're comfortable enough. Yeah, there's a height, are you? Okay. So I'm gonna put an anchor around the ankle. This one I'm not super worried about getting too tight because I don't have a whole lot of musculature here. The one I worry about is around the calf. So that's why we elevate her to get a little bit of a flex on here. I also ask them flex their calf for me so I don't get it too tight around here. And I can relax. And I don't pull on it either. Okay. So then we find out where her pain is. So if her pain is right along here, I'm basically going to make a box and frame in that area. So I'm going to put an anterior strip and usually like a medial strip. Okay. So now we have a box around that pain. We're going to make crisscrosses or X's starting from the bottom going up. So I like to pull the leg in, so I'm pulling medial to lateral, okay? So I'm going to start here, pulling up, and then coming here, still pulling in, but making a downward X. So you can see a little bit of X here. I'm just going to do that the whole way up her shin.
So medial to lateral, you start bottom.
And you start distal to proximal. Yep. I'm going to get all the way up to make sure that whole open box is covered. So as you can kind of see, my X's kind of got a little off this side. It's better to try and get these X's as into the middle of where that area as possible. I know it's kind of hard to see, you know, with that on the screen. But like this one I have an X here and this one I have an X here. Like these middle ones I do have down the middle. Okay? And then you just once again get all your anchors off. So anywhere you have tails that stick out tails here, we need to cover them up. So then I box her in again. Do one more around the ankle. So it won't pull super tight. And then I ask again that she contracts her calf. Basically lightly lay it around there. And then there's shin tape. Okay. Yep. Cool. Easy. Yep. All right. And one of these two, like too, when you, as you guys practice on each other, have your model hop down, walk around, and see if they can feel that difference of a point in and adding some of that compression onto the shin. So yeah, sorry, gentlemen. Might lose a few hairs today.
It's like the whole like thigh half is gone.
Yep, okay, sorry. Okay, I'm distracted by them all. Okay, next we're gonna do knee. Which one's actually first? Do you guys care which one we do first?
Whatever the is for you.
Okay, well, I got her standing. We'll do hyperextension, okay? So for today's purposes, I'm still just gonna use white tape. A lot of times when I put my anchors, you can pre-wrap if you want underneath. But my anchors are typically gonna be like a sheer white, so some type of stretchy tape to wrap around. Okay, so I'm still gonna leave her on our field block. Put an anchor that's distal to the knee. We're gonna put an anchor proximal around our thigh. Okay. So a couple ways we can do this. Do I have any? Is there any elasticons sitting around? We have 3-inch elasticon. Yeah, even if it's a small short roll. Get an idea. Most of the time for hyperextension and our collateral knees, I will use a elasticon with a stretchy kind of tighter tape. I personally don't take knees. Most of, especially all of my sports, I can get away with putting a brace or a hinge brace, those kind of things on them. But you get to certain sports, it gets to be a hindrance, primarily wrestling. Okay, so you're on the ground, grappling around. That's something easily, for them to grab onto and use as leverage for them. So you'll probably see Jordan more than anyone actually take a knee of somebody that might potentially need it. Okay, and that's for both hyperextension and medial lateral collateral ligament. And I think next week, we're going over knee braces. I'm not 100% sure. Probably staying with the lower extremity first. And so we'll go over and show you those types of braces. But if you don't have the luxury of being able to purchase them, or your athlete can't purchase them, there's other ways to get around it. For hyperextensions, I'm going to have you actually flip around for me. What kind of position do we want the knee to be in if we're doing a hyperextension? Next, in a non-pain position, so that pain for you into motion, okay? So we don't want to, I'm going to bend you just a little bit. We don't want to bend her too much, that it completely takes away, to be able to run or be able to function in whatever sport she's doing, okay? But we want it enough that it's going to prevent her from getting that full extension with it, okay? So make sure you ask her, like, okay, does this feel okay, or is this too much type of thing? Type with my elasticon. Same thing like we did with our Achilles. We're going to measure it. I'm going to cut it, and I'm going to put several strips. So I'll cut it. I'll put one strip up and down. I'll put one strip at an angle for an X, and I'll put a strip this way for an X, and then do my anchors again. Okay. Another way you can do it is with your white tape. Let's see if I can actually show this or not. With our white tape, you can make a fan with your white tape, and we'll use this fan for knee, elbow, wrist, those kind of things. So same thing, you're going to measure our distance, place it on the table, and you're just going to make X's. I'll hold this up when I get it too. Especially for a knee, you're going to want it a little bit wider to cover more of that area compared to a wrist or an elbow. And just make sure it's nice and structured and strong. Oops. So see how I now have a nice fan. So I go straight up and down, I make X's, a couple of layers deep, so it's nice and thick and strong. You don't have the stretchiness of an elasticon, but there might potentially be reasons why you don't want it. So then we attach to our top anchor, attach to our lower anchor, and then re-anchor it again. If you want, you can also take a small strip of tape and put it underneath it here, so if you don't want it to stick to her skin, got that around there. That way that doesn't stick and constantly come back off of her back of her leg. Then if you wanted to, you could take your shear light, take your power flex, wrap it all the way around. You could use some type of compression sleeve. So that way somebody doesn't come around and try and get under there and pull it, type of thing. Cool? All right. So I'll take that off. I'm going to have you flip around again. We'll do our collateral sleeve. Okay. So since it isn't super strong, when we are doing or protecting it, our collateral ligaments, most times, even if you're trying to prevent the MCL, you're going to provide support on both sides. Just that based on the tape isn't going to be as strong or hold up as well as if you would use an actual hinged brace. Okay, so your choice too, if you have an MCL sprain and you just want to protect the MCL, go for it. But most times you're just going to want to put it on both sides to help stabilize coming from each way. Okay. So we're basically just making, so our LCL is sticking over here, MCL is sticking on this side. So we're putting an X or kind of like a fan over those ligaments to help protect from our valgus and varus forces. Okay. We'll start with lateral. We're just going to go straight down, coming across, and actually we're going to wrap around opposite side a little bit. So I think that basically I want to make you make an X there. I'm actually going to come from underneath. Come around. And I'm going to come around. On the back side a little bit. And come across again. Okay? So I got the nice big X, and I'll probably, for good measure, put another strip. Probably not going to look super pretty, okay? And especially with our only 1.5" wide tape, doesn't cover a whole lot of surface area. Versus if I would use my elasticon, it's a lot more flexible, it moves with you, covers a bigger surface area, and it lays a lot flatter too. Okay. So obviously we've got some rolls around, use it, so we don't have a whole lot of practice tape with this because it's a little expensive. So I might be able to run downstairs and steal a few more so you can practice at least 1, 2. So this would be the same way, so I have X here, X here, X here, cover it up. Same thing then if we would do the medial side. If I didn't put my straight strip. I got X over top. Don't be afraid to start and wrap around the knee. In the way.
You do you, I'll handle the recording. I gotta do something.
All right. I did something weird because this should be framed a lot better. Yeah. Like I said, then you have to do it. I think I was supposed to come underneath here better. Because then your patella is basically framed in by your tape. Okay. But as long as you get the X's over the MCL, LCL, straight line over top, anchor bottom, you'll be good to go. Cool. See if we can get this off of here. Nice here. Let's take the color.
Yesterday they kind of dispersed around.
All right, so I think that's the most of the knee. The last one we have is the McConnell tape job for the knee. Okay, so now I'm going to have you go ahead and lay down or sit down. Okay, who remembers or knows what a McConnell tape job is for? Yep. So go ahead and lay back so your leg is straight on the table. Femoral pain, patellar instability, irregular tracking of our patella. Okay, so we notice that it's tipping weird. it's sliding off to the side weird, those kind of things. So those all go into your evaluative purposes of what you're trying to prevent. Okay, so we take our, so this is Omniflex, basically also called a coverall. Feels a little bit like a fabric, but it has a sticky, sticky back that actually sticks pretty well to the skin. Then we have McConnell tape, which is super sticky and even tighter than our moleskin. It's got no give at all. So as you use it and pull it, then wherever you pull it, it's going to stay, type of thing. Okay. I need scissors. So this is a 2-inch McConnell tape or Omniflex. It does come in like 4, I believe, 2 or 4, so depending on the area you want. So we're going to check where I need to completely relax. Yep. So we're finding where that patella is, and we're using our Omniflex to cover it up. So since this is 2 inches, it's going to take a couple strips. As you prefer to have this on a nice, clean, smooth, shaven surface. So sorry, gentlemen. If I do put this on a hairy individual, a lot of times I do sweat it off type of thing. If not, I usually have them take it off in the shower. We'll get in the shower, lather it up with soap water, let some water run on it, and they'll usually come off a lot easier. Okay. So say we have an irrelevant tracking patella that decides to go lateral. Okay, so it's potential to sublux, dislocate, whatever it might be. So we want to hold it laterally. So we're going to take a nice, strong, thick tape. I'm going to find where the edge of the patella is, and I'm going to put a couple strips. So I'm more on the superior half of the patella, and I'm going to pull it. Watch how it kind of wrinkles underneath of there, and then I'm going to lay it down flat. Okay. That's that kind of thing. So then I'll make another strip, pull it to help hold it medially, and come in. You can kind of see how it's a little bit wrinkled, a little hard to tell on there. But when she's running, jumping, moving, whatever it might be, that's going to help hold the patella in place. I don't use this tape a lot. I have before. Even though this stuff is pretty sticky, I find that especially with my running athletes, it comes off anyways and doesn't hold. So if I can use a brace for it, if I can use a patellofemoral brace, I'll try and use that instead of using some type of tape. Some athletes just hate having braces on them because they feel like they're cumbersome, it affects their play, whatever it might be, so they would rather try and go for a tape job and usually have to replace it every day. So, but this is kind of the same tape. I think I can take this stuff on. So say we have a patella that tends to inferiorly tip. So we just take this and try and push down to make sure that patella doesn't tip inferiorly. You can use it for contralateral movements. So it's just opposite whatever movement you don't want to happen, right? So say I don't want her to superior interiorly rotate. So I'm going to take this, I'm going to pull laterally, inferiorly, so get a little bit of an angle on that, to try and hold it into that opposite position. Does that make sense? And learning that will come along in some of your classes, a lot of your evaluative assessment classes. You're going to figure out too how to find interactions with the patella and why or how it's tracking wrong. So right now you're just learning how to prevent that or get rid of it. You will learn eventually how to assess why your knee or patella is tracking differently. Does that all make sense? Okay. I'm going to leave this on here for now because I'm not going to waste that. So I don't know, do we want to hand this out to practice taping or not?
I think you can just play around with the white
So
tape.
kind of just play around with the white tape. So you guys can come up and see it, feel it, get used to it, but then just come up with your white tape on somebody, and be like, oh, I think your patella is moving this way. Let me use my strip of tape. I'm gonna pull it this way, use a couple strips. Okay, so it'll be pretty easy to practice. I think the last one to learn is a dorsal, dorsal tape. So this one we would prep them the same way we would prep our ankle. You don't have to use pre-wrap if you just want to use your strips here. It's fine. You already have enough tape on there, but so same thing, we'll do our anchor, 2 anchors at the top. We'll do our anchor at the midfoot. Okay, remember always watching for that base of the fifth. Even though we're not doing ankle tape, we're still putting an anchor around that foot. So we're watching where we're putting that. Same thing, you can use your tape or you can use your elasticon. So I would measure it. Well, this one will be a little different than Achilles because I'll have you trim or cut, slice both sides. Like when we did our Spartan tape or the dog bone one. So, hold a little bit, anchor down here. Pull, and then come up there. Cool. Yeah.
So if you wanted to restrict even more, could you put your other anchor at the ball?
And you could, yep. So if you actually wanted to get even more, restrictive, you could put it further down into the midfoot. At that point, I'd say just make sure you use like shear light or something stretchier to be able to, so it doesn't get too tight around the foot. And this can be used in conjunction with an ankle tape. So I can put my ankle tape underneath of it. I want to really make sure they stay into that dorsiflex position. I'll add this guy along with it. Okay. I would typically put 2 of them. Like I said, if you don't have stretchy tape, use your white tape. Doesn't split and hold as well, but you can wrap it around and pull it up. Like I said, you probably just need to make sure you use a couple extra strips if you're using white tape. Cool. Questions? Practice.